So I wanted to make a quick video to share about a technique that I've been doing. So Shrimp here, he's not doing great. He was diagnosed with heart disease about a week and a half ago, and he hasn't been eating on his own at all for a long time. So that means, multiple critical care feedings every day, trying to do them every couple hours, and he's still just losing weight and just not very active. The hope is that the heart meds will get his heart strong enough, and then he will recover. He'll be able to eat on his own, but it's really like a race between the heart meds making his heart stronger and whether or not he's able to eat at all. But since I've been syringe feeding him so much lately, what I've been doing, now I've just been mixing the critical care, and right now I've got it about as thick as I can get it. This is the fine grind papaya, which I really like because piggies like the smell of it and the taste of it, and it's, even though you can mix it really thick, you don't have to cut the tip of a syringe off because it's ground so fine. So he's really sick of it, but what I've been doing is trying to give him as much as I can, like half of a syringe or a full syringe, and I'm trying to make sure that if I give him more than one syringe in a row, what happens is it seems like it just sits in his mouth. So what I've been doing is, in between syringes, I've been giving him a little bit of water. So first, I'll give him just like 0.1, just a little bit to kind of get his mouth wet. And I'll let him that sort of moistens up whatever extra critical care is in there. And so then I'll just give a little bit more. And what I'm trying to do is clear his mouth out. And it's also helping him hydrate. Now, if I put too much in, he kind of drools it out. Come here. And I'm also trying to be extremely gentle to him because he is not happy. He's really weak. But I still have hope. So basically, I'm trying to clean out his mouth, and then I go back with more critical care. I've done about, probably 6 or 7 in this sitting. And generally you want to do 20 milliliters if you can every couple hours. But in this case, and in the case where you have really finicky pigs, if you have a piggy that has tooth issues but they're otherwise okay, they usually are pretty open to taking some. But Shrimp has an enlarged heart. He was having lungs filled with fluid, although the vet said that she was able to hear his heartbeat a lot stronger after a few days on the heart meds. So I'm hoping. So there, that was like 0.2, 0.3. Another thing to think about is when you're mixing it with the water, if you can mix it with warm water, piggies that are not doing well, even room temperature, feeding them room temperature stuff is going to cool their core. So you might consider warming things up. Just make sure it's not too hot if you're going to do like a large session. So there you go. So now I will give him, and it's also important to let him chew, let him swallow it. The thicker the critical care is, the more they need to actually chew it, or, they can't just drink it down. So sometimes you can water it down a little bit more, and that makes it easier to drink down. But then, of course, they're not getting as much of the actual critical care. The thicker you make it, the more they can get per syringe, obviously. So now just a little squirt. Now you could see there some of the critical care just was kind of like oozing out. Come on. So that's why we really, little 0.1, 0.2 of water to try to get him to really drink down the rest of this critical care. And he's very messy, but I don't want to give him a bath when he's so weak. So I've been going through, and I'll use like a warm paper towel or a warm towel to clean him off. Okay, there. So you can kind of see, it helps to have really good light, which I don't have right now, but I've been practicing this. If you can see what's coming out of his mouth, if nothing comes out, so a little bit of soft critical care, mushy critical care came out. So I want to give him a minute. It doesn't hurt to have like a video playing or something, or check email or whatever. Give yourself a few minutes at a time between syringes if you can. This is very time consuming, but this is what we do for our babies because we love them. And as long as there's a chance, my vet did not think he was going to make it a couple days past the diagnosis. But he's got steady poops. They're small critical care poops. Okay, so it looks like I got most of that water in. So I'll let him drink. And I'll make another. I'm just trying to keep this critical care as thick as it can be and still be able to slurp it up here. There we go. So that's I don't know if you'd call it a trick, but that's been my technique because it's been really hard to get very much in. So in this case, I'll just do a little bit and see if he can get it in his mouth without spitting it out. Come on, Shrimpy. Come on. And then if I can get 5 or 10, then I'll give him a break and do it, in another 30 minutes to an hour. So let me know in the comments, do you have any special techniques for piggies that are really struggling for critical care? I think it really depends on the exact reason why they need the critical care. Because like I said, tooth issues, there are some things where piggies, they will eat the critical care ravenously, but they can't eat on their own. In this case, Shrimp's just not feeling well and doesn't really want to eat anything on his own. But again, the hopes that he will start feeling better as he recovers. Now, heart disease is not curable, but undiagnosed, an enlarged heart and fluid in the lungs can be really difficult. And I've seen piggies on heart meds basically bounce back, get way stronger, and live a long, healthy life. So he's already my old man, but I'm gonna try to keep the faith. So just a little bit of water to wash down what might still be in there. Come on. Come on up. All right. I hope this helped. Thank you guys for watching.